Welcome back. I'm Jenny Redmond from RTI International. Now that you've had your drinking water tested at the laboratory, you're waiting for your results. We will send your results via your email. If you do not have email, we will also mail those results out. Your laboratory results will be divided into 3 categories. The first category will be results that are above the North Carolina action level. The second category are results that are below the North Carolina action level but above the laboratory detection limit. And the third category are results that are below the laboratory detection limit. For results above the North Carolina action level, the state or local public health department will notify you and come visit your center to check the tap and resample it to confirm the laboratory result. While that tap is resampled and it's being analyzed at the state public health laboratory, you want to make sure that you do not use that tap. You will place a do not use sign over the tap to ensure that no children or staff are using it. Once the second sample is analyzed, we will identify whether it is still above the lead hazard level. If it is, the state or local health department will help you identify the best way to get the lead out of that tap. 3 recommendations are: 1, to contact a plumber and make sure you don't have a clog or an issue with the pipe. 2, to potentially change your faucet fixture, which may contain elevated lead. And 3, to install and maintain a filter that is certified to remove lead. The second category of results are those that are below the North Carolina action level but above the laboratory detection limit. Our laboratory detection limit is 0.1 part per billion. We will let you know of those samples in the report, but you will not get a visit by a local or state official. Now, since any level of lead is not good for children to be exposed to, we still do recommend no-cost or low-cost solutions to get that lead out as well. Some of those recommendations can also be installing and maintaining a filter, or it may be something like flushing water in the morning. Lastly, any results that are below our laboratory detection limit mean that there's a result that is below 0.1 part per billion. Make sure that your clean water habits include only using cold water for drinking or cooking. Even if you're going to boil water, don't start using the hotter water. Make sure you start cold and then you would boil the pot. Another thing to make sure that you do is after holidays or weekends or other times when the child care center is not in use, you can flush water, for example, in the kitchen sink for several minutes, and that would help clear the pipes and put new fresh water into the center. Another thing to do is to always make sure that you contact a plumber if you notice that you have a clog or something that isn't working well at a tap. Now, for installing and maintaining a filter and also for replacing faucet fixtures that may be problematic, please reference our next videos. You can find more videos on NC Child's YouTube channel. With your help, we can ensure that our children are drinking clean water while they're in childcare. For RTI International, I'm Jenny Redmond. Thank you so much for watching.